Hey y'all, this is Nurse Ivory coming back with you today with an update in the cannabis world space. Just talking about some things that's been on my heart and mind. So I just wanted to drop in and share it with you guys. I am wearing my red today in honor of the month of February. Go Red, American Heart Association recognized women in heart disease. So I just wanted to take a little time to recognize that as well and to tell you ladies to be sure to get your heart health checks, making sure we're exercising, eating well, and all of that good stuff, especially during this pandemic time. So I just wanted to drop that in before we get started. So today I wanted to talk a little bit about how we may have not noticed that COVID and is maybe paving a path in regards to cannabis nursing. So in my state, I'm in the state of Louisiana. Um, our governor has appointed two boards or two commissions to one to look at health equity, another one to look at the economy, to give him recommendations from a health equity standpoint as well as from an economic standpoint following the beginning of the COVID pandemic. Both commissions have actually recommended permanent full practice authority for nurse practitioners. So those of you who may not know, at the beginning of the pandemic, when everything was haywire, nurse practitioners, I know in my state, if I had to guess, it's probably something national, or if not national, most of the states have are allowing temporary full practice authority for nurse practitioners. That's huge. That's something that the nurse practitioner industry has been advocating for forever, to expand healthcare, particularly in rural and underserved communities. So that's something that has been a hot topic issue. So it's sad to say, but it took the pandemic, a COVID pandemic, to come to for the nurse practitioner industry to get that practice authority. Now it's temporary, but in my state, in Louisiana, these two commissions have basically rendered recommendations to the governor in a push for full practice authority based upon the work that nurse practitioners have been doing in this space during this pandemic, and the need for them to continue to be a huge asset to our healthcare community moving forward as we work our way throughout this pandemic. That's very important. The other thing that has changed or that's been an asset, unfortunately, as a result of the pandemic, is the expansion of telehealth and telemed. So you guys may have done it yourself or help coordinated for a family member, where you simply, dial into your computer or dial on your phone, and your doctor's office, your doctor is at his office and you're at home, and you are having a telemed or telehealth visit. So that's something that has been expanded, and that you will see it'll probably be a big national push to continue the expansion of telehealth, telemed. So those are two things, the telemed as well as the temporary full practice authority for nurse practitioners, are two of the things during this pandemic that can be game changing in the field of cannabis nursing as we move forward, especially if those things become permanent. As a nurse practitioner, if you're not a nurse practitioner, I'm not a nurse practitioner either, but when I think of the opportunities, for one, if we think about cannabis nursing, all states do not allow nurse practitioners right now to recommend. Well, if nurse practitioners get full practice authority, that opens up the opportunity for them to be recommenders, because now they will have full practice authority. Um, so that's going to be important in that space. So if you're a nurse practitioner, that's an opportunity that you may want to be looking out for. Be checking with your state to see how that will affect you and how you may can either start a business or expand a business. If you're not a nurse practitioner and you're a nurse, but you still have an interest, you can still start and open up your own clinic. And you can actually hire contract a nurse practitioner to service cannabis patients. So it's a win-win to me in the cannabis nursing industry, especially if you adding in the telehealth, telemed piece of it, because if that, like in my state, I'm in Louisiana, a lot of people, if you're like contract compact licensure, um, and say you're in a neighboring state like Texas or something like that, you can have a business here in Louisiana, but you can still incorporate telehealth, telemed, to where you only come in to see your patients maybe once every other month or whatever, but you're incorporating telehealth, telemed into your practice. So I just thought that those are huge opportunities. So I wanted to get on here and to share that with you guys. So what are the steps or what you need to look for? Like I said, in my state, the governor set aside two boards to look at, health equity, and the other one, the economy. So go to your state's website, go to the governor's page, see if you can find out any information on if either one of those type of boards or any boards have been appointed by the governor. Most of the time, if you find the meetings for these type of boards, they even have an opportunity for public comment. So that's an opportunity, if the board is already set or established, to where if you want to have any input, you can add input into the public comment, and that may be one thing that you can bring forth to say, hey, I recommend, or look at you guys to please consider looking at nurse practitioners um, ability to permanently practice in a full practice independent capacity. That's something that you can inject yourself in and become part of and make a difference in your local community for these recommendations. So those are two of the things that I just wanted to bring up. Check with your local state, see if it's anything going on, and if it is something going on, figure out a way that you can inject yourself in the space to bring back impact to your state. So thank you guys for listening. If you would please like, share, and subscribe. I'll try to be coming more often with videos. My next video, I think I'm going to be talking about American Nursing Association and its impact that you can have as a member, and how you can leverage your cannabis nursing career. So check back soon.